shall be the business as set out in the third revised report of the Business Committee dated 30th of April 2020, with no questions on promised legislation. 2. Between each item of business, the House shall suspend for a period not exceeding 5 minutes. 3. Item 4, statements and questions and answers on COVID-19 to the Taoiseach shall not exceed 100 minutes, with each party or group having 10 minutes, and the Taoiseach may make a concluding statement which shall not exceed 5 minutes. 4. Item 3A, motion re-membership of the Committee on Procedure. Item 3B, motion re-proposed authorisation by Dáil for the Houses of the Oireachtas Commission to instruct legal representatives. And item 3C, motion re-quorum shall be taken without debate, and any division demanded thereon shall be taken immediately. 5. Item 5, statement by the Minister for Business, Enterprise and Innovation and questions and answers on business supports for COVID-19 shall consist of an opening statement by a Minister or Minister of State of 10 minutes, followed by questions and answers not exceeding 110 minutes, with questions and answers from Fianna Fáil and Sinn Féin not exceeding 15 minutes each, and all other parties or groups not exceeding 10 minutes each. Item 6, statement by the Minister for Health and questions and answers on COVID-19 shall consist of an opening statement by a Minister or Minister of State for 10 minutes, followed by questions and answers not exceeding 110 minutes, with questions and answers from Fianna Fáil and Sinn Féin not exceeding 15 minutes each, and all other parties or groups not exceeding 10 minutes each. Item 7, statement by the Minister for Agriculture, Food and the Marine and questions and answers on COVID-19 shall consist of an opening statement by a Minister or Minister of State of 10 minutes, followed by questions and answers not exceeding 110 minutes, with questions and answers from Fianna Fáil and Sinn Féin members not exceeding 15 minutes, and all other parties and groups not exceeding 10 minutes each. And 8, the Dáil shall adjourn on the conclusion statement by the Minister for Agriculture, Food and the Marine and questions and answers on COVID-19 until 12 noon on Wednesday, 6th May 2020.
Proposals set out by Deputy Smith for today's business agreed? Agreed. Thank you very much. With that then we move straight on to questions and statements from the Taoiseach. Now let's be very clear here. We've asked each party and group to indicate are they making statements or are they asking questions, or statements and questions, and they've all indicated. So the Fianna Fáil leader is up first. Deputy Martin, you have 10 minutes for a statement.
Taoiseach's first, Chair.
May a maximum.
Thanks for clarifying that.
Not just yet, Ceann Comhairle. Ceann Comhairle, anubh mar a Harlíonn leitheanta eile, sfuoinimid dóibh siúd a fuórbás. Daoine raibh saol agus scéalta acu, a raibh tábhacht agus brí ag buinte lena saol, agus cuimhnófar iad. Tá an rialtas buich do chuile gcuine atá ag obair go dtíon chun dulling leis an coronavirus. Tá sibh ghlacú mhórbáirt sa ghearcéim seo. Má ghlachan tú páirt trí de chuid oibre, nó mar tá tú ag fanacht sa bhaile. Tá torthaí agus go-iarracht agus táid ag cur an acíd faoi cois. Tá is agam go bhfuil na teorna deachar agus go bhfuil sé bearánach a caitheamid leanúnta raig. Táid faoi comhain acu siúd atá ag obair chun dulling leis an víreas seo, gach lá agus do cuimhne na daoine a fuórbás. Táid faoi comhain dar bubble féin. Ceann Comhairle, I offer my condolences to all of those who've lost loved ones since we last met, to everyone grieving as best they can in most difficult circumstances. As of last night, we had 976 COVID deaths confirmed by a laboratory. A further 214 deaths are suspected, giving us a likely overall figure of 1,190. Of the laboratory firm cases, 453 died in hospitals, 430 in long-term care settings including nursing homes, and 93 at home. Of the total deaths, 697 had been residents in long-term care. This is a tapestry of sorrow, suffering and loss for our nation. As always, we're grateful to the extraordinary work of our nurses, our doctors and our healthcare staff, who are giving their all to save lives and bringing us through the worst of this emergency. As a country, we owe so much to so many, and when this is over, we'll have the opportunity to thank them properly. I know the lockdown is difficult and people are feeling frustrated, cooped up, even trapped, but we must keep doing what we're doing because it is working. We owe it to those who are fighting the virus every day, and we owe it to the memory of those who've been lost. As a country, we owe it to each other. People want to know when things are going to go back to new normal. and I can inform the Dáil that a plan is being developed to ease the lockdown, a roadmap to reopen Ireland, a roadmap to what will be a new normal. Unfortunately, for those who would like an immediate return to a pre-COVID world, the easement of the current restrictions will be slow and gradual and will be done in a stepwise, tiered manner. It will require continuous effort to suppress and control the virus. Therefore, the lifting of restrictions will not necessarily mirror the manner in which they were escalated. Public health and safety and our healthcare capacity will continue to be the foundation for decision making. Our 5 criteria are as follows: the progress of the disease, healthcare capacity and resilience, testing and contact tracing capacity, the ability to shield and care for at-risk groups, and the risk of secondary morbidity and mortality due to the restrictions themselves. As we manage the gradual lifting of restrictions, we'll prioritise public health advice and give careful consideration on how best to mitigate and manage the economic and other health and social impacts. Any changes to the restrictions will be made every 2 to 4 weeks, as we need to leave a period of time between changes to accurately assess their impact. We will intervene earlier, though, if things appear to be going off track. Restrictions may have to be reintroduced if it looks like the virus is going to surge back. We expect to have this plan completed tomorrow for approval by Cabinet. My thanks to the party leaders for their input yesterday. I also welcome the views of TDs here today. If a consensus exists, I want to find it. Ceann Comhairle, it's always been my assessment that we've been fighting COVID-19 on 6 fronts. PPE to make sure our staff are protected, testing and tracing, ICU capacity, hospital beds, ventilators, the economic and welfare package to protect business incomes and livelihoods, societal actions such as social distancing, and protecting vulnerable groups, including people in care homes, prisoners, travellers, Roma, the homeless, and those in asylum seeker accommodation centres. It never was, nor ever should be, a case of prioritising one of these over another. We have to fight the virus on all 6 fronts every day and deal with the new challenges that arise every day, and they do. As the World Health Organization says, you need a comprehensive strategy, and to date our strategy has been comprehensive, far-reaching and inclusive. On testing, so far over 150,000 tests have been carried out in Ireland. That makes Ireland 6th out of 27 EU countries on a per capita basis, and a higher number now than many countries that have led the way on testing, such as Germany, South Korea and Singapore. We'll continue to increase capacity and improve turnaround times, but there will be bumps in the road. I want to thank all of the staff involved, including GPs and occupational healthcare staff, assessing people for a test and counselling them on the results. There's an extraordinary team effort in our testing centres, from people in admin to the swab takers, the medical scientists and staff in our laboratories doing the tests, and the IT professionals and managers who make sure all of it comes together. So thank you all. Recently there has been much public focus on nursing homes, and rightly so. This is an area where much work has been going on behind the scenes for a considerable period to protect as many people as possible. Ireland took the lead in deciding to test asymptomatic residents and staff in nursing homes wherever there's been an outbreak, and other countries are now following suit. From the very start, we counted nursing home deaths alongside hospital deaths every day. I see other countries are now starting to do that as well. In recent weeks, we provided a funding package for nursing homes, and PPE deliveries are now regular. The total PPE deliveries daily is now 558, and 3/4 of those go to nursing homes and long-term care homes. There are now 23 community response teams in operation across the country, and they're being helped in their work by 16 infection prevention and control staff. About 200 HSE staff have now been redeployed to private nursing home facilities, and home care workers and home care hours are being redeployed to long-term care. When it comes to staffing, we have an agreement with unions to allow HSE staff to work in nursing homes. It is voluntary, but we are asking people to volunteer, to take up posts in nursing homes and to help out there. As a government, we've taken a focused approach towards vulnerable groups, including homeless people, travellers, Roma, drug users, prisoners and residents in Department of Justice accommodation centres. This involves testing, treating, isolating and cocooning, as well as tending to other health conditions. Having met and spoken to many of the people and organisations caring for these groups, I'm satisfied that we have a robust and well-resourced response in place. Ceann Comhairle, there's been much debate about comparisons with cases, deaths and death rates in other countries. On the face of it, we compare well with our neighbourhood in Western Europe, but not so well with other parts of the world. However, the more I study this, the more it seems that the data are not yet comparable. They're not even comparable between North and South on this island. Countries are at different stages in the pandemic. Some have peaked and some have yet to. Some parts of the world, including Eastern Europe and much of the Southern Hemisphere, appear to have been barely affected by the virus so far. I hope that doesn't change. While Western Europe, China and the United States have been the epicentres. The scale of testing also varies greatly. Our policy here is to test, 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 and we're in the top tier of countries in that regard. Countries also vary in terms of demographic makeup. Also, different countries count differently. Our policy is to count all cases, laboratory confirmed and suspected, all locations, hospitals, care homes and private homes. We also count all cases regardless of whether or not there is an underlying condition that may have been the main cause of death. We are only one of 4 European countries that does so, to the best of our knowledge. The only truly comparable data will be mortality displacement figures, what are often called excess deaths. We may not have these figures for some months. In any case, it's not a competition, and every country is doing its best in difficult circumstances and different circumstances. Ceann Comhairle, I'm increasingly concerned that some people who need medical care are not seeking it. I met a GP in DCU yesterday in one of our community assessment hubs, and he said he hadn't diagnosed anyone in his practice with cancer for a month. He'd never experienced that before. We know cancer hasn't gone away. Perhaps people are afraid of contracting COVID-19. Perhaps they don't want to be a burden on our hard-pressed healthcare staff. But my message today to everyone is to seek help if you need it. GP surgeries are open. Emergency departments are open. Ambulances are operating. Please seek medical attention if you need it. Finally, Ceann Comhairle, it's now 7 weeks since I announced the first actions we were taking to slow the virus in its tracks and push it back. I said then, acting together as one nation, we could save many lives. By staying apart, we've come together as a nation, and we have saved many lives. But we're not out of danger yet. More lives are at risk, and we cannot falter now. In the days to come, we'll provide a pathway for how we will emerge from this crisis and give hope to people that there is light at the end of the tunnel. But it can't be false hope. We are still in the tunnel, and we've some distance to go. As before, I look forward to hearing members' observations and suggestions. Gurmian Lagat.
Gurmagat híisigus gamaliscéile suchtan dul mú a bhí orm ag tús. Féin mu den iscadí ceanar éana fáil an teachta Mícheál Martin agus tá denóméid agat.
Gurmagat Ceann Comhairle. Dúspáir déanam chomhrón le taglaí gacéine a forbás días gan vírus corónach. Is céircéim ó fása é seo ó héamh cuasaí sláinte de agus gan áras geileagar na tíre chomá. Tá na cuidaoine díostathe sa tír agus is léir go mbeidh dúchláin ollmhór roing amach sa todhchaí. Tá míad fíormhuíocht de gacéine atá ag obair sna seirifísí sláinte agus sna seirifísí eile ina bhfuil tácht fiile ag bintlo na siopí agus na monachan éagsúla. An rud is táchtaí ar fad ná i mthormse séiléirú a dhéanamh i gcónaí maidir le gach gné den ggéirchéim seo. Mar shampla cábhfuil na clusters éagsúla, cábhfuil siad lonathe, an bhfuil feibanna fiile in áiteanna fiile nó in ionad fiile. Agus is ceisna táchtach iad son agus mthormse tá míad ag glóraigh níos mó hiléirú ar ceisna den taishin. Our first thought today must be with the 1,190 families who have lost a loved one during this pandemic. Their suffering and the struggles of the thousands more who have required urgent care are a reminder to us all that this pandemic has been every bit as serious as we feared. This unique and terrible crisis has required an exceptional response, not just here, but also throughout most of the world. It is another proof of how much we rely on each other, locally, nationally and internationally. Throughout the past 2 months, every part of our society has played a role in the response to the pandemic and has felt its impact. I believe that the resolve to do everything possible remains strong. No one believes that the threat is gone, and no one expects a rapid reversal of every control measure. However, there is a real and growing uncertainty, and for many a deep unease, founded on the lack of clarity about what the next steps are. The government should never forget that Dáil, much of the media, and of course the Irish people have been willing to suspend much of the assertive oversight which a free democracy like ours insists on. This should not be taken as permission to limit debate and to expect that people will simply wait to be told what they may be allowed to know. In fact, the only reasonable response to the controls which we have collectively accepted on our rights is for government to actually increase transparency and meaningful consultation. Every significant study ever undertaken into the response to major emergencies has shown that trust depends on transparency and effectiveness depends on allowing different voices into discussions. And I've consistently said this from the beginning in terms of the location of clusters, for example. I think it was 6 or 7 weeks ago I would have identified problems in the healthcare settings, particularly nursing homes. Likewise in other centres as well, as I've identified in terms of meat plants and in particular locations. And I don't see in other countries, district by district, the incidence rates are just published, and there doesn't seem to be any negative pushback or fallback as a result of that. And I think that's something that should be done here as well, because it might positively impact on human behaviour. Because as I said, you know, how the trust does depend on that transparency and effectiveness as well. As we continue to move away from initial and the most severe phase of responding to the pandemic, there are many hundreds of decisions to be taken which will impact on the health and livelihood of different sectors and communities. They must be given a proper role in discussions. It simply is not good enough, in my view, that announcements are made by the Minister of Children about the childcare services without meaningful consultation with the childcare sector. And it's not good enough that the nursing home sector is not formally represented in key discussions. And I'd add, Taoiseach, that the pay deals for the nursing unions that was already agreed, and apparently DEPR have no issue with this, but for some reason there's been a reluctance or a delay in following through on the payments. These are agreements of last year. Apparently they haven't followed through yet, and the nursing unions have made representations to us in that regard. And that's something I think, given the role that the nursing profession have played in this crisis, it's very difficult to comprehend why those pay deals haven't been honoured and delivered upon. And I think we'd also say that it's simply not acceptable that in area after area there are background briefings about what is expected to be decided, but the relevant groups of employers, managers and workers have not been brought into the discussion to help shape the decisions. No one is expecting a perfect response, and absolutely everyone accepts the pressures which key parts of the public service are working under. However, the spirit of common purpose is not being used enough, and critical discussions simply have to be more systematically opened up to inclusive participation. As things stand today, there is widespread unease about the lack of clarity on the basis upon which decisions will be taken. This is not the same as a demand for certain decisions, simply a wish to be told in direct terms what the triggers are for certain key policy decisions. Such clarity has been provided by governments in many countries. Last week, the Taoiseach said in response to the Dáil asking for clarity that decisions on lifting restrictions would be taken in light of 3 general considerations: epidemiology, hospital and ICU capacity, and the ability to quickly test and trace. Yesterday, party leaders were told in unequivocal terms that testing is now not an issue in terms of the lifting of restrictions. I think it was in response to a question that was put by Deputy Alan Kelly. And I just think we need a bit more clarity on that, given what has been said to date on this. The premature announcement of testing capacity in the past was acknowledged, but we were told that the capacity is in place to carry out more testing and will be in place later in May as well. We're also told that while hospitals are operating well within capacity at the moment and at a capacity which other countries have seen as providing for possible increases in COVID cases, there is a desire to be careful on this front, and I understand that. Where there is no clarity is what the triggers will be in relation to epidemiology. The reproduction number has been below 1 for some weeks, and the public information suggests that the main concern is hotspots rather than broader community spread. We also need more information and more answers about the impact on other health issues of decisions taken in relation to the pandemic response. In recent days, doctors in many countries, including Ireland, have been drawing attention to the fact that we must understand that delayed diagnostics and treatment in other areas will lead to higher non-COVID mortality. And I think the Taoiseach has referred to that in his remarks as well. Most of the diagnostic capacity of our country is lying idle. So too is much of our national public and private capacity to treat other diseases. Doctors throughout the country are reporting how people are not presenting with diseases such as cancer, which has not suddenly become less prevalent. I'd say on the private hospital issue, that still hasn't been resolved. And I think there's a bit of a mess made, I think, in terms of how on the contractual issues around that have delayed, really, treatments. And I think it should be, every effort should be made to bring that to a conclusion so that we can get more procedures done in the interest of patient safety and continuity of care. We need an urgent assessment of what is to be done to address all of this. And I think a really significant second strand has to develop a non-COVID strand in terms of our acute hospital system. And as I've said, part of it is in relation to the private hospitals, where the spending of many millions on empty wards, cannot be justified continually. I understand the reasons why it had to be done initially. We did need a capacity, but we need to be utilising it to the maximum. It has been reported that tomorrow there will be a cabinet meeting, and the Taoiseach has said that, after which you will announce a strategy for the period ahead. At a minimum, the Irish people need to be given clarity on the exact basis on which changes will be triggered, and it can't be more of the "we'll tell you when we have decided" approach. The move away from a severe lockdown will only happen in gradual steps, but these need to be outlined, and sectors need to be given the opportunity to propose actions which they can take to operate within health guidelines. While the science is absolutely clear, the shaping of policies to respect this science requires debate. Without a clear proposal from government on future steps, Dáil and the media will not be able to perform their core roles of oversight and debate, and we will be denied the opportunity to represent voices which currently feel marginalised in discussions. In the coming weeks, a proposed social protection estimate will be brought before the Dáil. This estimate is required as a result of the unprecedented scale of the economic impact of the pandemic and policies to respond to it. As we have said to the Government, this vote requires proper scrutiny. It cannot just be presented as a measure to be nodded through. We will be insisting that there be a detailed review of the proposal, such as it would receive if normal work were in place. And as part of this, we want a full and open assessment of the economic impact of the pandemic. At the moment, we have macro assessments, but very little beyond this, and we are concerned that there are many issues which have not emerged yet. We want to hear a full assessment of the impact on the finances of public companies. For example, we are currently operating a public transport system which is receiving almost no revenue, and the NTA have been less than responsive to their need. What is to be done to fill this gap? We can see throughout Europe that governments are preparing bailouts of public companies and nationally critical enterprises. For example, the German government is preparing an enormous funding package for Lufthansa. When will we be told at least a broad outline of these challenges? What is the current state of local authority finances? What is the assessment of the hit to be taken by higher education institutions? And there are many groups of workers who need us to consider their situation. Fixed-term workers in research facilities are critical to the response, but they face heightened uncertainty about their status. And frankly, it's not acceptable that workers abandoned by Debenhams in what looks like an opportunistic timing of store closures are having their names taken by Gardaí when they undertake responsible socially distanced demonstrations. They cannot be deprived of the right to draw attention to their situation. In the next report on the Just Transition, if I just conclude, in relation to climate change, it was emphasised that the digital transition also carries with it major social and economic challenges. And if it's true that habits developed during the pandemic will lead to an acceleration of the digital transformation, we will need an acceleration of measures to help those adversely affected by it. And on face coverings, again, I think there's no credible alternative now to adopting their use, particularly in public transport. Other countries have assessed their role, and I'd ask Taoiseach if you might. I think there's going to be some advice coming shortly on that. Thank you, Ceann Comhairle. I think the shared national effort has achieved much in the past 2 months. We all know it's not over, but we need an inclusive approach to preparing for what we do next. Thank you.
Sian Kate Kaintorella na Canara Sinn Féin agus tá ráis cúig nó méid agus Sinn Ceist.
No, Cahir, Beidir.
Okay, talk about.
So, Boilum Keshtaker, I'd like to ask a question. I'd also ask that the Taoiseach doesn't talk down the clock, because then I'd like to speak again and hopefully we get an exchange.
Question first, is that it?
No, I'd say a few words, ask the Taoiseach to respond, then I'll say a few words. Kind of like a tennis match.
All right.
Okay.
Yeah. Anyway.
So, Guramila Mayagut, Ceann Comhairle, I want to add my voice of sympathy and condolences to everybody who has buried a loved one in these most heartbreaking of circumstances. I want to acknowledge, and I think it's important to acknowledge, that from the start the right model and approach was adopted in response to this public health emergency, and credit is due to everybody for that. The approach being test, isolate, trace. And to do that in a comprehensive manner. Also, the advice given by way of public health notice to the general public to stay connected but to stay physically apart, to the hand hygiene, all of that has, I believe, been an outstanding success. The emergency measures and restrictions that have been introduced have been very, very difficult for people, for families. Some are really struggling with them, and I think we need to acknowledge that. But the country and communities have rallied magnificently. And of course, our frontline staff in particular, and particularly within the health services, are again to be congratulated and thanked. And of course, the best way that we can thank them is to pay them well and to respect their work, not just in the heat of an emergency, but always. We've made extraordinary asks of people, and we will continue to ask that precautions are observed. And therefore, it has been most unhelpful that members of government have engaged in thinking out loud and kite flying, and created nearly an impression that May 5th was a red letter day when we would all be liberated from these restrictions. That caused confusion. I think it was unfair, and I think it was doubly unfair, having done that, to then criticise complacency and to almost point the finger at the public or sections of the public. So I hope we won't have a repeat of that. I very much welcome, Taoiseach, and you might confirm that tomorrow you will in fact set out the roadmap ahead. I think having made extraordinary asks of the public, of our people, we have to, at a minimum, do them the respect of giving them clear, comprehensive information, and doing so very transparently. I want to raise a number of issues with you, Taoiseach. The first is testing and tracing. We now have a target of 100 tests per week. I would like you to confirm for the Dáil that target will be met, and you might set out how it will be met. I'm mindful that announcements have been previously made and citing very large, ambitious targets, and it never matched actually what was happening on the ground. So, at what point and at what date will we have the 100,000 tests? Will that happen in real time? And will we have the tracing to match and to complement that? I want to raise with you also protection for vulnerable groups, which you cite as the second condition for any easing of measures. I have to say to you, if we look at what's happening in our nursing homes, you could not be confident that we have the provisions, resources and protections necessary for that very vulnerable group of people. So when will nursing homes have enough staff? When will they have adequate personal protection equipment? When will the testing of nursing home staff and residents be completed?
I've counted more than that, but I'll get straight into answering them. Just the question about the roadmap for reopening Ireland and the roadmap to new normal. Yes, it is our intention to share that with the public tomorrow, but that is subject to the outcome of an EFID meeting in the morning and subject to a cabinet meeting in the afternoon, so not entirely under my control. The target capacity for testing is 100,000 a week. Again, I want to emphasise it's the capacity to do 100,000 tests a week. It's not a target to carry out and do 100,000 tests a week. The number of tests that's done per week will depend on the number that are needed and will depend on the clinical criteria and other matters. So we won't be looking to test 100,000 people a week. We'll want the capacity to test 100,000 people a week. And as I mentioned earlier, we're already in the top 6 in the European Union in terms of testing per head, and well ahead of many other countries that are cited as being the models for testing, like Germany, for example. On nursing homes, as I mentioned in my speech, I'm informed that PPE deliveries are now regular, and we do want to know if there's any issues in any particular nursing home that isn't getting PPE testing. is largely complete. Again, bear in mind the plan is and was to test nursing home staff and also residents in all nursing homes, but not necessarily all residents in all nursing homes. Because if there is a nursing home that hasn't had the coronavirus, there is a risk in bringing somebody into it to carry out the tests. So you need to make sure that you get that right clinically. I think they were the questions.
Taoiseach. So this is a problem now. The announcement was made of 100,000 tests per week. And the presumption is that, of course, you have to do that, you have to have the necessary capacity. But certainly, I believe the correct thing is for this 100,000 tests to be real tests and not some just notion that we say theoretically we have the capacity to do this. You will know, Taoiseach, as well as I, that from the very, very beginning of this pandemic, the international advice, the best scientific and medical advice was test, 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 then isolate, then trace, trace, trace. I believe that it is very, very dangerous to propose unwinding emergency measures in the absence of comprehensive testing. And that means the 100,000 tests have to be real tests. It can't be a target. It can't be an aspiration. It has to be 100,000 tests that go through the laboratory and that get the results in a timely fashion back to the person concerned. And I'm very worried today that on the brow of announcing your roadmap out of the emergency measures, which we all want to see, that there is still a reticence, a lack of ambition, a lack of intent in terms of the extent of testing that we need. I'm sure you're not going to challenge the view of the World Health Organization and others which say that you must test, test, test. And how do we keep our population safe in the absence of that very comprehensive testing? So I'm troubled, I'm concerned, Taoiseach, for you to confirm on the floor of the Dáil that this is an aspirational target to build capacity rather than to carry out the tests. And I want to put it to you that testing to the extent of 100,000 a week is necessary because we need to know where the virus is. That's what all the experts tell us, because it is only by knowing where it is in the population that you can actually isolate and do the tracing. There's a contradiction in the position of government and the system, because we have heard talk saying, well, we're going to test asymptomatic people with no symptoms. I mean, that strikes me as a wise approach. But it is in total contradiction to what you have set out here. So, Taoiseach, can I put it to you that the 100,000 tests should be real tests? It shouldn't be an aspiration or a target. And can I ask you to take actions to make sure that that is in fact the case?
Thank you very much. Taoiseach, to conclude on this.
Thanks, Deputy. There's no big reveal here. This has been on the record for days, if not weeks. The target is to have the capacity to carry out 100,000 tests per week and to have a good turnaround time in doing so. We're not going to carry out random testing just so we hit 100,000. The target isn't to carry out 100,000 tests. The target is to carry out as many tests are necessary, and we believe that we need a capacity of 100,000 to be able to do that. So we're not going to carry out random tests just to get to 100,000. If we ever do random testing, it'll be a seroprevalence survey, and we'll only do a seroprevalence survey when we have a serological test that is up to scratch, that can actually do that and give us useful results. We're not there yet. The tests that have been the tests have been developed. The antibody tests are not up to standard, and you may have seen the HTA produced by HICWA, which goes through that in detail. But we may have, and Roche may as well, but they haven't yet, Deputy. And we're not going to use it. And unlike other countries, I don't want to answer Deputy McDonald's question. You didn't leave any time to ask any. Sorry. We may get to the point in the next couple of weeks or a couple of months where a company does produce a serological test which works, in which case we would be raising the 100,000 to a much higher level. but that test doesn't yet exist. And in terms of the number of tests, that's based, as always, on the clinical criteria.
Deputy Eamon Ryan,
Thank you very much, Nick and Corla. With statement. I was very interested to listen to the Taoiseach, and he set out the 6 criteria from the WHO, I think, in terms of how you manage the crisis, and I wanted maybe to go through each in turn in terms of our assessment of how we're doing. And first and foremost, in that critical issue of social isolation, again, I'd have to report, Taoiseach, that my sense as a country is that we have done well. We have actually shown that a Western democratic system without necessarily some of the strict controls that we saw in other countries, is able to actually self-regulate by and large. Police and guards have done a good job, but largely it's been people self-regulating. And my sense is, and the figures we're seeing from the CMO and others, is that self-regulation is working, is bringing the reproduction rate of the virus right down. And I think it's a great commendment to the Irish people that we've shown that capability. We shouldn't ignore that. Similarly, I was talking to a colleague this morning. You said the second test around PPE. Stephen Matthews, my colleague, was just telling me anecdotally this morning of a story of a local company. I think he knew a sail-making company that a business collapsed because there were no orders, obviously, with the downturn. But they've managed to turn it around and start producing gowns now at scale and using some materials they got that weren't being used in another industry, and being adaptive and being quick. And I think what the state did in terms of organising those 300 Aer Lingus flights, as much as there is still real tight pressure point, particularly in our nursing homes in terms of PPE, I think by and large an assessment would be, compared to other countries, that we've also done well in that regard. And thirdly, in terms of the positive side, I recall well at the start of this process talking directly to people involved in intensive care units in hospitals around the country, and the sense of terror they had, rightly, because when you saw what had happened in Italy and what had happened in Spain when a health system is overrun, that was really a daunting prospect. And while the workers in the front line there have had a really difficult time, I'm sure any assessment would be that actually we were quick and flexible in scaling up our ICU capacity and other hospital capacity, and that we have avoided that overrun of a system, which was the fundamental fear. And I think there's great credit to the HSE and to the people within our hospital system that flexibility, and even if some of it's now seen as overcapacity, you know, the contingency that we have, in my understanding, the numbers out in City West are minimal, tiny so far, thank God. And we've a lot of these public or private hospitals we've contracted, as Deputy Martin says, underutilising the beds now. But we didn't have to build emergency field hospitals. We did it in our flexible way, and I think we did it by and large well. So in those 3 of the 6 categories, I think you'd have to say that the state has actually reacted quickly and reacted well. On the other 3, firstly, with regard to how you protect vulnerable groups, and there was a prime time the other night, a professor from UCD making the point that our nursing home systems particularly wasn't able to adapt as quickly as we saw our hospital system did to the changed circumstances. And that there's a real tragedy there has unfolded, as has happened in other countries. We're not unique, and particularly not only for the patients but also the workers there who have a high instance, as I understand from our discussion with Dr. Tony Holohan yesterday, a very high relative instance of infection. And I think if there's lessons to be learned and changes need to be made here and now, it is in the need for us to look at our nursing home systems and how can they adapt possibly now and for any particular future waves of this pandemic. That's an area where no one could say, and it's not just our nursing homes, what's happening with some people in direct provision, or even in other, I know Deputy Martin's mentioned examples of certain particular sectors, be it meat factories or whatever, where we weren't able to make the changes that we were able to make in our hospital system. And that's something that we have to address now, but also learn lessons from the future. With regard to testing, the 5th of the 6 categories that you set out, Taoiseach, I again would say I think we started at least in making the correct strategic decision, unlike in the UK maybe as one example, where we didn't abandon kind of community testing. We were willing to try and keep up testing even as the wave of the virus hit. I mean, it's clear that we haven't succeeded in actually delivering what we promised. And everyone has anecdotes on this. I mean, Mary Lou is personally. In our house, his son was tested 35 days, I think, ago, and we still haven't got the result. Now, he's as healthy as anything, thank God, but everyone has those stories, and that undermining of public confidence in those delays has been a real regret. And I think, even though it's due to a variety of factors that may be out of control of certain of the health facilities, reagents and other issues, we should acknowledge that we weren't able to deliver what we promised, and we sure as hell have to start delivering what we promised now, because in the next phase of managing this crisis, I remember Paul Reid saying, and the Assistant Director of the CMO saying, is that the testing really comes in as the critical issue when you start to open up the economy, so that you're really able to very quickly identify clusters, very quickly isolate those people and engage in contact tracing. So the account of how this state does in terms of how we manage this in the testing side, while we've got problems that have gone back now the last 6-7 weeks, the real test is in the next 6 months, 1 year. And this is a country which is leading in IT technology, which is leading in terms of a lot of medical health capabilities. We should be best in class, and we should make sure that our testing system is as fast as anywhere, and our contact tracing system is absolutely rock solid and quick. The sixth and last category, Taoiseach, you mentioned was economic welfare, and that's also the one that we really have to face and address now. And again, I'd have to commend the state, the government, in terms of the initial response was quick, which was part of what we need to do in providing the pandemic unemployment payments, providing immediate supports for business. But that really is only the first phase of what we need to do. And I think the unlocking of restrictions can't come quick enough, not just for the sense of people's public morale, but also because our economy is in a shocking state, and we need to start lifting it. In doing that, we have to do it commensurate with not allowing the virus come back. So that's obviously a given. It's not one versus the other. But can we do both? There are certain issues I think we should target what are our measures. Firstly, it's very clear that young people are the ones who maybe suffered disproportionately most. The statistics I saw last week or this week was that the level of use of the unemployment payment, the pandemic unemployment payment among young people, among those aged 18 to 24, was twice the level of any other age category. So they're the ones who are probably most, out of work and we need to focus on. And secondly, with regard to small business particularly, again, if you look at the latest figures around where those, just to take that unemployment payment as an indicator of where it's hitting home, in the accommodation and food sector, which would be typically large numbers of small Irish businesses, the level of use of such payments because of the lockdown is 7 times the level of layoffs that occurred in the industrial and public administrative sector, 7 times higher. And our small business sector, and I come from it, so maybe I've got a particular interest in it. It's the heart of our economy. It's the strength of our community. It is a huge employer, but not just that. It's part of our culture. It's the high street. It's family businesses which mean a lot to people, and it's only when you're involved in one you know what it's like, that this is your everything, this is your whole, and often a history of family. And we're in real danger of losing so many of those family small businesses if we don't really act quickly now to try and help them recover. Now, how we do that is a real challenge. You're facing a difficult choice this weekend in terms of this staged 4-5 stage rollout. I do hope we can start doing something this weekend, even if it's very small. Even I said to you yesterday in terms of like a friend being buried this morning, a funeral, where the restrictions are you can only have 10 people. And this lovely woman was from a big family. And you can only be in the church or the funeral home, whatever, for 15 minutes. And I thought, we can do a funeral at social distancing, and maybe not the big funerals of the past, but just slight easing of some of those restrictions. Our easing restrictions as well, and people being able to walk. We can trust our people to do this social distancing where our older people are able to get out and get exercise and get fresh air. But also I hope, and I mentioned it when I spoke here last week, a lot of those small businesses work in tourism, and I'm not reading the papers yesterday as much as I know what's planned, to talk that we would be opening up late summer to kind of possibly go on a holiday in Ireland, if at all possible for us to get people, our young people particularly, the prospect of out walking, cycling, swimming, meeting, but not meeting carefully, and helping our small businesses recover. That too is part of the test we have as to how we manage this overall crisis.
Taoiseach, I'd like to commence my contribution today by paying respects to all the people who've lost their lives and their families. May they rest in peace. I also want to thank again all the workers who are making such sacrifices for us all. And coming up to May Day, I would hope that you would acknowledge that in some rather significant way this year, above all years. Taoiseach, I have 4 areas I want to speak about today. The first one is relating to transparency of government actions. Second one relates to testing and government contributions around that. Third one is how we all use language. And fourth one is in relation to your roadmap. Last week, I asked a number of questions regarding transparency of decision making. I again want to restate my support for NEFIT, Taoiseach. And last night you wrote to me answering some of my questions, except you didn't answer them. So I will be writing to you again. I still don't know why minutes aren't recorded at the beginning of every meeting and signed off on. I still don't know how people are appointed to NEFIT. And you still haven't published the letters from the HSE, from the chairperson and from the chief executive to the Minister and the Department of Health regarding their concerns on governance. Would you please publish these letters? I'm asking on behalf of the people of Ireland in a very transparent way. What's there to hide behind? Since last week's Taoiseach, I've been inundated with people who have been asking me about issues regarding the transparency of decision making. So people are concerned, now more than ever, because transparency isn't a luxury in our democracy. And I think also there needs to be a rebalancing in relation to democratic accountability. It's fantastic that we have so many members of NEFIT appearing on the media, but I also think the odd time they need to appear before some formation of these houses. We've received unpublished legal advice regarding how we can meet from the Business Committee. But I also believe that what the Labour Party said at the very beginning of this regarding setting up a committee on COVID now needs to happen. And the laws allow for it, Ceann Comhairle. And this needs to happen imminently. It happens in New Zealand. It even happens in the UK, as much as we deride them. In a letter to the President of the European Commission, the European Ombudsman, Emily O'Reilly, said that maintaining high standards of good administration may seem particularly challenging in these times. However, it is exactly during such times that high standards across all areas of public life are needed, more than ever. She is not wrong. And we need to be able to speak clearly and honestly with citizens in order to maintain the democratic processes, and we need to show everything transparently. Secondly, Taoiseach, I believe the Minister for Health and NEFIT have legally overstepped their mark on decision making when it comes to testing, which did lead to those letters being written. Under Section 70 of the Health Act 1970, it is the function of the HSE to, quote, make arrangements for carrying out tests on persons without charge for the purposes of ascertaining the presence of a particular disease, defect or condition that may be prescribed. Under the 2014 Act, the Minister must lay before the Houses any general written directions regarding its statutory functions. This, in this case, did not happen. So the Minister prescribes the disease and the HSE is responsible for making the arrangements to test for the same disease. But the Minister and some members of NEFIT have been demanding a quantum of tests beyond the HSE's capacity without first consulting them. So I've gone back and logged where this requirement to meet 15,000 tests a day appeared first, and it seems to be on the 18th, 19th of March, following a visit to the NVRL by yourself and Minister Harris. You've referenced this visit yourself a number of times. Minister Harris said the following day that 15,000 would be reached in the next, quote, in the next few days. Then following the CMO's appearance on the Late Late Show on April the 17th, this suddenly changed to 100,000 tests a week. It was mooted that this needed to be achieved now within 10 days. And the following day, NPHET said it urgently needed to happen, and we understood that lifting of the restrictions on May the 5th was indeed conditional on this happening. But now that seems to have changed. Now it is not conditional. But during all of this, no one bizarrely asked the HSE, could they deliver it? Because the answer was clearly no. That's why those letters were written. For instance, they didn't have control over the labs. They didn't have control over all the levers here. That's why they couldn't deliver it. So, Taoiseach, government actions throughout all of this have to have a basis in law. And the actions here, as regards the instructions to the HSE, didn't. Taoiseach, I also want to raise the use of language, because it's critically important in these days. As the poet Ivana Boland, who sadly passed away this week, often wrote in her poems, the language you use is the making of us. She said, language has the power to redeem the damages that have been made. As we remember her and her life, that quote is very apt for how we communicate in these days, Taoiseach. The kite flying and tone from government at times over the last 2 weeks has simply been unacceptable. The government, you Taoiseach in particular, the Minister for Health, and indeed some members of NPHET have been creating a narrative that the citizens of Ireland who are doing their best to stick to the rules that are in place are in some way to blame for the restrictions not being lifted, when the real reason is nothing of the sort. Taoiseach, you cannot dangle citizens' freedom in front of them. You cannot say, if you adhere to the rules, then we'll give you your freedom. The relationship the Irish people have with the state during this pandemic is not a transactional one. It is one that needs to be built on trust and respect. The CEO of the HSE, Paul Reid, tweeted on Monday about this in a very direct and timely way. Quote, one of the best lessons I learned in life is the difference between commitment and compliance. Commitment has to win hearts and minds. This is what we need to do now, and not just talk about compliance. I personally believe you need to listen to Paul Reid a lot more, Taoiseach. The Irish people, Taoiseach, have been very patient since March the 13th, when schools and creches closed. We all know that, and we thank them. What they need now is honesty and clear communication. People need hope, not to feel shamed. The whole pandemic is having an extraordinary impact, as we all know, on the well-being of our nation. Those over 70s feel that more than most. I think of my own parents. So you need to, this weekend, give them hope more than anyone else. These are the people who are in the later years of their life, who have been the most disciplined in this crisis and have contributed more than anyone else to creating this great country. But many now feel patronised by how they are being treated. And I, for one, am urging you to give them some hope this weekend, however small. And remember on Friday, when you update people on restrictions and set out your roadmap, Taoiseach, that these need to be your decisions, your government's roadmap, not NPHET's or the CMO's. And I don't think we can continue with the CMO making pronouncements all the time before they are considered by you or the government. And I think you agree with me on that. You need to be holistic and assess where we are at and the impact of further restrictions. What will the impact be on the rest of our health services? You've spoken about secondary morbidity. I know of a consultant in Limerick who diagnoses cancer 8 times a week, but hasn't done so for the last 4 weeks. So these people are walking around, they don't know that they have cancer. We have a lack of screening, bowel screening, cervical screening, breast check. We also know we've elevated mental health risks. On top of that, there is the socio-economic impacts of maintaining restrictions. So all of this needs to be considered. And that's what a government's role is. We need to start a conversation on what Irish society looks like living with COVID-19 that brings citizens with us, not making them feel like they're in the bold corner. Citizens need to see a coherent, staged exit strategy from these restrictions. Businesses need to plan for the new world. Their instructions on what they need to do need to happen this weekend. Not when they need to do it, but what they need to do to prepare. Taoiseach, nobody expects you to absolutely get everything right over the next few weeks. I certainly don't. But we do expect to see a vision from you, and we do expect to see action from you. Actions that you will stand over. They're your actions, your government's actions. And we cannot allow perfection to get in the way of progress, because we will not, in these unusual times, be in any way able to perform such an act. But remember this, collectively, we are all here to serve the citizens of Ireland. This weekend, Taoiseach, the citizens of Ireland need to see political direction. They need to see a plan, and they deserve to be given hope. I wish you well.
Thank you, Deputy Kelly. Now, the Social Democrats, Deputy Shortall, your 5-minute statement and 5 minutes for questions.
Yeah, roughly that, yeah. Thanks, Ceann Cordy. At the outset, I want to express appreciation to the outstanding work that's been done on the front line, particularly by health workers, and also to express the condolences of the Social Democrats to the many families who have lost loved ones in this pandemic. Taoiseach, from the first case of COVID-19 in this country 2 months ago, we've been told that the strategy was to establish a robust test and trace regime which could rapidly identify each new case, trace the contacts, isolate them and thereby contain the virus. We needed to do that at sufficient scale for this to work. Unfortunately, we've never come close to the scale required. It's true that testing among healthcare workers has been reasonably satisfactory, but it's also true to say that, in the main, the curve has been flattened and the virus somewhat contained due to the severe restrictions on movement which were introduced on the 27th of March. It has proven exceptionally difficult, I have to say, to get clear and straight answers to questions about the reasons for the delays in achieving the original strategy set out. And that applies to either government or the health authorities. It's been really difficult. We've had to ask questions 3, 4, 5 times to try and get anywhere close to a reasonable answer. This has particularly been the case in relation to the severe shortages of reagents, and that still remains a mystery as to why the government won't come clean in relation to that. While the public has played their part, increasingly it's being seen that the government has not delivered on their side of the deal. I believe this is leading to a loss of confidence and growing frustration among many people. The authorities need to level with the people, explain clearly what is happening, including the problems, and provide straight answers to questions. Unfortunately, there's been obfuscation and spin about the entire test and trace strategy, and regrettably, after several weeks of lockdown and sacrifice, the failure to implement the strategy will mean the lifting of the restrictions will be delayed even further. I think, Taoiseach, it's somewhat disingenuous of you to disregard this as the main issue for not lifting the restrictions. I was interested to hear you saying that yesterday. The fact of the matter is, of course, that unless we have a clear test and trace strategy, as originally proposed, the numbers in hospitals and the numbers in ICU will grow. So, this is a circular argument from you. The original problem at the nub of all of this is the fact that we haven't delivered on that strategy. Taoiseach, 2 weeks ago, I asked that you would consider establishing an expert task force to plan and oversee the lifting of restrictions. You told me the Cabinet Subcommittee is the task force. It's not. With respect to that body, it does not contain the kind of expertise required for this very challenging and complex task. Such a task force should be guided, of course, by public health experts, but it must also have representation from a range of other sectors. General health, mental health in particular, which is a growing issue now, education, business, transport, industry, and so on. And critically also, it must contain the necessary risk assessment and logistics skills for the planning and management of such a major and important undertaking. Its work should be done in public, with clear explanations and accountability for each of its decisions. The phases of lifting the restrictions and very clear metrics for triggering each phase should be published also. The price which people are paying and will continue to pay for a long time demands openness and transparency about decisions which impact their lives, their livelihoods, and their futures. What we've had is behind closed doors decision making. Political spin, kite flying, media leaks, and a very unsettling absence of candour. That won't be tolerated for much longer, Taoiseach, and I'm not just talking about at a political level. In terms of the public generally, they're getting very frustrated and they won't tolerate any further obfuscation in relation to the strategy. I want to move to the question of the cost of responding to the health crisis and the ensuing economic crisis. The actions to date, including the COVID payment and the wage substitute scheme, have been correct, but the next steps in relation to a phased return to work and supports for SMEs and dealing with personal debt in particular will be crucial. Again, it's why we need an expert-led task force. The longer it takes to implement the test and trace strategy, the longer this will be delayed and the costlier it will be. Last week's Stability Programme update, unsurprisingly, painted a very stark picture of the challenges ahead, and we know that the cost of responding will be substantial. Of particular concern is the fact that the SPU spending projections actually fall below the budget projections for next year. It's inexplicable that that is the case. The aim of economic strategy must be to provide an economic stimulus rather than retrenchment and austerity. This can only happen if the ECB provides zero funding or negative interest rate funding to member states. The big question, of course, is who will pay for all of this? We cannot repeat the mistakes of the last recession, where Ireland was saddled with huge debt, which resulted in severe austerity, the impact of which is still being felt. Within the EU, this must be viewed as a Europe-wide problem, and we need a Europe-wide solution. It would be entirely unacceptable, in my view, for the ECB to respond with costly loans, and that is why the government must vigorously pursue a fair and just response to the devastation caused by this deadly pandemic. And the government must be open and transparency about what that strategy is. And that's why I'm asking the Taoiseach to outline the approach that he took last week to the European Council meeting and indeed which he will take to the follow-up meeting tomorrow. It's important, Taoiseach, I think, that you tell us what is your attitude in respect of a longer-term lifting of the fiscal rules. Do you support the idea of corona bonds? And what exactly is your strategy in Europe?
Thanks, Deputy. I do support the proposal to have corona bonds, and that's not a secret. I think I said that a week or two ago. Everyone should know that, and that essentially is a mechanism by which we would collectivise European debt solely for the purpose of paying for the cost of the crisis. It could be just health spending, or it could go beyond health spending to include the money necessary to re-stimulate the economy. However, as I think anyone who's familiar with European issues will know, that would require a change to the European treaties. And it is highly unlikely that that's going to happen, because in order to change the European treaties, every country needs to want to do that, and some countries need to hold referendums on it. So for that reason, alternative solutions are being developed. We expect the European Commission to come to us next week with proposals as to how we can use the MFF, the 7-year budget for the EU, and also borrowing perhaps by the European Commission as a means to do something similar. And a proposal has already been developed involving the ESM by the ECOFIN, by the Council of Finance Ministers, and that's already been approved. It was approved last week by the European Council. In terms of the fiscal rules, as you know, when it comes to Stability and Growth Pact, the clause that allows us to make an exception, the break clause, if you like, or the get-out clause, has already been activated. And I've always been of the view that the fiscal rules can or should be amended depending on the circumstances that we face. But I think something that's often missed by people when we debate the fiscal rules is the rules are there for a reason. You know, somebody didn't just invent fiscal rules because they thought it'd be a great idea. And the fundamental idea behind the fiscal rules is that if we're part of a single currency, if we're part of a European Union, sooner or later you do have to balance the books. Yes, in times of growth, when the economy is going well, it makes sense to rein in spending, to run a surplus, to pay down your debt, so that in difficult times, like the very difficult times we're about to go into, you can then borrow, you can then spend, you can then re-stimulate your economy, and you can avoid austerity. But anyone who thinks that the fiscal rules can be gotten rid of, so that countries never have to balance their books, never have to stop borrowing, never have to rein in spending at some point, that's just fantasy land. And no future government can operate on that basis. What the next government can do is to increase spending, increase borrowing, do that to pay for the crisis, do that to stimulate the economy, do that to get people back to work, businesses open, and the country going again. But at a certain point when the country returns to growth, you do need to balance the books. No country will survive if it thinks that it can base its fiscal policy on always borrowing more, always having a bigger deficit, never balancing the books. That's Zimbabwe, that's Venezuela, that's Weimar Germany. Doesn't work, doesn't work.
Thank you, Taoiseach. Now we move to the Solidarity People Before Profit group. 2 sets of 5-minute questions, isn't that it?
Yeah, as per the format, with sharing with Deputy Murphy. Taoiseach, I've been looking for transparency on the advice on which you're basing your decisions since the 20th of February in the first briefing, and I've asked on 6 occasions and never got an answer for the minutes, the written advices and the position papers of the expert advisory group that advises NEFIT and the government. And I've never even received the courtesy of an answer. Will you publish those minutes, those written advices, and those any papers they have produced? Tomorrow is May Day, and you heaped praise upon frontline healthcare workers earlier, as everybody rightly has. Could you then explain why the hundreds of nurses and other healthcare workers who have applied on the Call for Ireland to work for the health service in this public health emergency have been given the worst possible contracts with CPL, an agency recruitment firm, which are 3-month temporary contracts with no sick leave and with no right to the Unfair Dismissals Act? Is that the way to treat the people, the heroic people, healthcare workers who volunteered to work in a public health emergency?
Thanks, Daddy. I'm afraid I don't know the details of that. That's new information to me, so I'll have to check up on it. As far as I understand it, anyone is entitled to access the Unfair Dismissals Act. That's a law that applies to all workers. And obviously there are sick pay and sick leave arrangements in for everyone at the moment who needs to take time off, particularly as a consequence of COVID. But I'll certainly check into that and come back to you with the written reply. Quite a number of deputies have asked questions that are questions of NEFIT and questions of the Expert Advisory Group. I'm not on NEFIT and I'm not on the Expert Advisory Group. And others have asked questions relating to the HSE and have asked me to publish documents that are not in my possession, nor are they in the possession of my department. So I'm very happy to answer questions that I know the answer to. And I'm very happy to publish documents that I have. But some of the questions that are being asked are really questions for the CMO. And they're questions for the CEO of the HSE, and I can't answer questions on their behalf, but I can ask them to answer your questions, and I will do so.
Boyd Barrett, you've just a little over a minute.
That's the contract, and I've read it, and it's very clear. It's a temporary special purpose contract for 3 months. So when we need permanent increases in staffing in our health service, we're giving the worst contracts possible to people who seeking to work in the public health emergency. Can you just issue an instruction to NEFIT to tell the Expert Advisory Group to publish the minutes and the advices of the Expert Advisory Group, so we can hear what the scientists and clinicians are actually saying? A further question: the Leaving Cert. Why are you continuing with the Leaving Cert when we don't know where we're going to be? When the stress that those students, the uncertainty and so on that they are suffering, and when a majority of Leaving Cert students are looking for certification that doesn't require the stress of sitting the exam, and indeed when many of them may have underlying health conditions where they'd be very worried about going into that environment. Can you please answer that question?
Thanks, Dáil. Just coming back to what you mentioned there earlier, NEFIT has agreed to publish the minutes of its meetings, and its advice to government is already published. In terms of the Expert Advisory Group, that's not advice that I ever see. It's not in my possession, and there may or may not be reasons as to why they can or cannot publish it, but the CMO is the best person to answer that. I think there was a good debate on the Leaving Cert last week in this chamber, and the vast majority of people who spoke from most parties, from what I've been informed, spoke in favour of the decision to continue with the Leaving Cert, and the plan to do exactly that is being developed at the moment by the Department of Education with a view to the exams starting, I think it's on the 29th of July. And the thinking behind that is that the alternative, which would be predictive marking, raises all sorts of difficulties as well. The concerns, for example, by some students that their teacher mightn't give them a grade that they believe is fair, or, for example, that it may be based on the mocks, and students doing the mocks didn't realise that the mocks were going to be the basis for working out their results. So there's huge difficulties with predictive marking. It's not impossible, but I think if it were done, we'd be dealing with the whole raft of issues with regard to it.
Corla. Taoiseach, we're now beginning to see the long-term economic impact of this emergency, and the question of who will pay is going to loom extremely large. Will we bail out workers, or will we once again bail out big businesses? And unfortunately, the indication from the government so far in relation to its attitude to the airline industry is that the same mistakes of the past are going to be repeated, and that it's the CEOs and the big businesses which will be bailed out. There's millions of flights cancelled, there's tens of thousands of people who are due and entitled to full cash refunds. But the airlines have dragged their feet using all manner of obstructions, and the Irish government has now taken the side of the airlines, has pushed for the European Commission to scrap normal consumer rights and allow airlines off the hook. Instead of refunds, you want the airlines to be able to keep the cash and issue vouchers instead, effectively bailing out the airlines with consumers' money. Taoiseach, why are you taking the side of the airline companies instead of the side of passengers?
Thanks, Deputy. I think if you're fair to us and you look at all the major actions that have been taken by government to date, they have been to bail out people and they have been to bail out workers. We've had a massive expansion of the welfare budget in the last couple of weeks in order to provide the pandemic unemployment payment at €350 a week. Compare that to the United Kingdom and Northern Ireland, where it's less than £100 a week, or what's happening in other countries. That's a very big bailout of people and workers. Also bringing in sick pay arrangements that we never had before in this country. Again, very much a bailout of people and workers. And also the temporary wage subsidy scheme, now being availed of by 40 or 50,000 companies. That money only goes to the companies if they pay it to their workers. Not a bailout of the bosses, not a bailout of the shareholders, not a bailout of the people who own those companies. Money going to companies only to pay a portion of the salaries of their workers. In relation to the airline industry, as far as I understand it, the law is, and the law hasn't changed, that people are entitled to a cash refund. I'll have to check that, but my knowledge is that the law has not changed in that regard. However, we do have to be practical about this. I don't want to see airlines fail. Whether they're publicly owned or privately owned isn't my major concern in that regard. I want to see Ryanair and Aer Lingus operate sometime later in the summer and sometime in August. And I wouldn't like us to be in a situation whereby we end up having to bail out airlines because they fail.
Murphy?
You might not be aware, but you're right that that is the law, but your government, with 11 others, have written to the European Commission calling for the law to be changed. I find it hard to believe that you aren't aware that that's the position of your government. The second more general question is precisely about the future of airlines, because they are, in a sense, the banks of this crisis. IAG is cutting 1/3 of its jobs in British Airways. They're likely, unfortunately, to move to do the same in terms of Aer Lingus. And so is it not time now to accept that the privatisation of Aer Lingus has been a failure, resulting in job losses, wage cuts and putting regional airports at risk? We are now paying the wages for Aer Lingus in any case, and so instead of bailing out private, big polluting industries, is it not time to renationalise Aer Lingus under the democratic control of the workers, and in that way to plan for sustainable transport networks with a significant reduction in airline travel?
Thanks, Deputy. The government hasn't taken any formal position on the matter of vouchers or refunds, and there may be something at department level, so I'll have to check that. But even so, I doubt that any law could be changed retrospectively. I may be wrong about that, but I've never come across anyone changing a consumer protection law retrospectively. It might be changed prospectively, but I don't see how it could be changed retrospectively. But I will get a briefing on that, but there isn't a government decision on it. I think objectively the liberalisation of air travel in the world has been an extraordinary success. Just think of all the connectivity that Ryanair provided that wasn't possible when airlines were owned by national governments, how they totally disrupted air travel and democratised it and made it possible for everyday people to afford to fly to all parts of Europe. So I think liberalisation has been a huge success in terms of aviation, and socialists have been proved wrong in that regard. I think the success of Aer Lingus has been a real success too. Never had more staff and never had more flights than they have now. What's happened to the airline industry? Is because of a virus, and whether it's a national carrier or a public company or a private company, they've all been downed because of a virus, not because of any ideology.
Thank you, Taoiseach. Now we move to the regional independent group. Deputy Lowry, you're taking 5 minutes for a statement and 5 minutes for questions.
Orla, the entire world is currently transfixed by COVID-19, and this is, of course, understandable. This virus has impacted people's lives like nothing else has done in living memory. However, other significant issues remain to be dealt with. I refer specifically to Brexit. Serious and unresolved matters surrounding Britain's exit from the European Union are more crucial now than even before the onset of COVID. Brexit implications are looming large. We now face a double whammy with a combination of a no Brexit plus the economic battering of COVID-19. The impact of the two together will have massive and far-reaching consequences for Ireland. The EU has wisely advised that Britain extend the transition period to avoid compounding the economic damage caused by the COVID pandemic with a rushed Brexit. Prime Minister Johnson has stated on several occasions that he is adamantly against seeking any extension. This intransigence leaves us with a huge dilemma. The political declaration envisages a no-tariff restriction trade regime for agri-food and manufactured products on the island of Ireland. However, the declaration also requires the UK to achieve regulatory and technological alignment with the EU to avoid EU-UK tariffs. This remains a major problem as there is no clarity as to how this will be achieved in the short time frame left between now and the end of December this year. As of now, the UK will leave the single market and the customs union on the 1st of January next year. And it begs the question, how advanced are our preparations to implement new measures around customs procedures, regulatory checks for goods, foods, animals and bloodstock crossing the Irish Sea? The time frame for preparations and action is now very limited. The outcome of the EU-UK talks on a future relationship is of critical importance to Ireland. It has the potential to have a devastating impact on our economy. Ireland has always been uniquely exposed to Brexit compared to other EU states. The UK is Ireland's third largest export market with a value of 16 billion. Ireland is also heavily reliant on the UK for food imports. Nearly half of all food imports come from the UK. 1 billion of goods and services are exchanged between Ireland and Britain on a weekly basis. Our exports, our agri-food sector and tourism are alarmingly dependent on Britain. In that context, Taoiseach, could I ask you a number of questions? Firstly, has COVID-19 crisis, has that influenced or changed the government's Brexit strategy? Can the government provide a commitment to maintaining all the existing Brexit funding and support programmes considering the cost of the COVID pandemic? Can the government provide specific assurances that the agri-food sector, which is the most exposed sector to Brexit, will be sufficiently supported ahead of the transition period on the 31st of December this year? What preparations have the government made to help prepare businesses for the new situation on the 1st of January? When will businesses know the details regarding the checks and controls? And when do you anticipate the EU and UK to agree to these issues? And do you accept, Taoiseach, that these decisions need to be made soon in view of the short lead-in time so that the necessary customs and duties infrastructure is put in place? Business needs certainty about these issues. Could I ask you what progress is being made on the implementation of the Irish Protocol of the Withdrawal Agreement in respect of controls and checks between Great Britain and Northern Ireland, and to outline the implications for the Republic? Have you had recent contact with Prime Minister Johnson, or do you intend to put our concerns directly to him? And finally, Taoiseach, could I ask you a question on a specific issue regarding beef farmers? As you are aware, markets are curtailed, demand has dropped, prices have slumped, cash flow is now a major issue for beef farmers in Tipperary and throughout the country. Could your government commit to bring forward direct payments to beef farmers from October to July this year? These monies are due under European Union funds, and the measure I am proposing would greatly assist the cash flow for this category of farmers.
Thanks, Deputy, and I want to thank Deputy Lowry for reminding us about Brexit, because it's not gone away, you know. And I think in many ways we planned for a potential shock to our economy to occur in early 2020, and we thought that might be Brexit and managed to avoid it, and instead we found ourselves dealing with a much sharper shock in the form of COVID, which has affected the economy in the way that it has. The joint committee, which is made up of the European Union and the UK, can extend economic Brexit happening, if you like, for another year, but they haven't yet taken that decision, and the UK government has expressed their view that they want to go ahead on the 1st of January 2021, and that ultimately is their decision rather than ours, but the option is there to extend it another year should they wish to do so. So far, the COVID-19 crisis hasn't influenced our Brexit strategy, but it does fundamentally change the context because it's totally changed how trade works and the state of our economy and our fiscal capacity. I can provide a commitment that we will maintain all existing Brexit funding and support programmes, notwithstanding the COVID pandemic. But again, some of these are going to be matters for the next government. And I can give an assurance to the agri-food sector, which is most exposed to Brexit, that they will be sufficiently supported ahead of the transition on the 31st of December. I was asked as well when we would know the details regarding the checks and controls. And when do I anticipate that the EU and the UK will agree to these issues? I don't know for certain, but it always had been envisaged that it would be done by June or July, before the traditional summer breaks, thus giving business a good 6 months to prepare for any of those changes that are going to take place, but that they're not agreed as of yet. But I totally agree that business needs as long a lead-in time as possible and not a short lead-in time. In terms of beef farmers, and all farmers have been badly affected by Brexit, or by COVID. We will have seen how the milk price is falling as well. But beef farmers have been suffering for years now, and this on top of that has made things really, really severe for them. I think the Deputy suggested that we bring forward direct payments for beef farmers and perhaps all farmers from October to July this year. And they are EU funds the farmers are getting anyway. So it might make sense to bring it forward. It's not money they wouldn't be getting anyway, but at the very least it might help with cash flow. And I do think that's a good idea, and I have spoken to the Minister for Agriculture about it to see if it is possible. In terms of my contacts with Prime Minister Johnson, just in the last couple of days, contacted him to wish him well on the birth of a baby boy, and then previously was in contact with him regarding his illness. We haven't had a chance to speak about substantive issues such as COVID and Brexit since the middle of March, but now that he's back to work this week, I'm sure we will.
You're finished, Grant. Thank you very much. We move now to the Rural Independent Group, and we're going to hear 2 5-minute statements in this instance. Deputies?
Yes, thank you very much.
Deputy Michael Healy-Rae.
Taoiseach, first of all, I'd just like to say, first of all, and this is most important, how sorry I am, and the other members of the Rural Independent Group, for all of the families who have been devastated by the loss of loved members of their families. And I also just want to put on the record of the Dáil, a very special friend of our own, Jean Tagney from the Black Valley, who now is on day 26, I think it is, of being in an induced state, fighting this virus. And I hope that Jean will come out the right side of this battle. He's a great character. The Tagney family are very close friends of mine for many, many years. And my heart and soul is with him in his battle, and I want him to get better. Taoiseach, many compliments are rightly being paid to our nurses and healthcare workers. Tweets are being put out by government and by people. But what I want you to do, Taoiseach, is I want you to pay them. Pay them the allowances and the agreed deal that was there already before COVID. And I want them to be paid immediately because they're only looking for what's rightfully theirs. With regard to the COVID payments, seasonal workers are losing out very badly on the €350 per week. They should also be included in that, because just because if this had come a couple of weeks later, those people would have actually been, they would have been there from the 6th of March on, and they would have got paid. Also, people who are over 66, they're not looking for €350 per week. What they're saying to me very clearly is that if they could get the balance between their pension and 350. In other words, people who are over 66, for instance, there might be a couple that were on to me yesterday who were running a public house, paying their taxes all their years, and now they find themselves, their income is gone, and they're left with just their pension, but they still have all the bills of that business that they have to keep the building there and keep it intact. I would also like for you, Taoiseach, for you, if you can at all, I'm sure you're aware of the situation. I know I've spoken again today to the Minister for Justice about it directly on the phone, about the direct provision centre in Carasaveen and the public healthcare concerns that we have for that centre, for the people that are in it, for the people who are working there, and for the people in Carasaveen and in South Kerry. And will you please make a statement on that? Also, with regard to the Leaving Cert students, I'm terribly disappointed that the students themselves weren't listened to, because they really feel that they weren't. There was a great campaign organised which I supported, and those students weren't listened to when it came to the setting of the Leaving Cert. Also, with regard to our beef farmers, during the week I met with our own Kerry representatives of the IFA, who diligently put together a very important programme of what they need and what our beef farmers and what our family farmers in County Kerry and throughout the country need. And for example, there is money, 25 million euros, that was there from last year, which should immediately be made available to our beef farmers. Also, as Deputy Michael Lowry has rightly stated, the October payments should be brought forward to July, which would make a massive help to our family farms, to their budgets. It would just get them over a hump. And I also wish to, because they're in a desperate way, and I also wish to point out just an example to what local authorities are going through with regard to a funding crisis. In Kerry, our tourism sector is worth over 600 million euros alone to the local economy, which is now expected to take a loss of close to 500 million. This will be detrimental to our local economy. The effect it will have on big businesses, which will be huge. They will not be able to afford their commercial rates, which have now been rightly frozen, and I thank the government and I thank our local authorities for that. But again, taking Kerry for an example, their projected rates income when passing a budget last November was 42 million. It is now looking like, from initial projections, to hit as low as 24 million. And they have now sought a compensation package from government so that they can carry on their activities, their essential services. And this is not just the case with our local authority, Kerry County Council, but also the other local authorities throughout the country, who I also want to compliment for their work, as I want to compliment the people in University Hospital Kerry, in Killarney Community Hospitals, Kenmare, Carrickiveen, Valentia, our nursing homes, the staff that are in them, that are working so diligently in this major fight. The Gardaí, and again our local authority workers. Everyone is putting their shoulder to the wheel. I want us all as politicians to work together, Taoiseach, and to do this in a very hard-working fashion, to try and ensure that, first of all, we do what is most important, that is protecting the health of our citizens. And also, secondly to that then, trying to get the economy going, trying to get the wheels going. And I want you, Taoiseach, to give our people optimism over the next couple of days. I know you have very important announcements to make, but I'm pleading with you. I know public health concerns is the most important, but also giving people something to look forward to, giving them confidence, letting them show that there is leadership in the country and that we're all going to work our way out of this together. To the older people who are over 70, who are inside in their homes, to let them see that we're fighting on their behalf and that we as a country are going to rise out of this the same as we've taken on everything back over the years. We'll take this on and we'll win. But taking into account, of course, health care, which is of vital importance.
Thank you very much, Ceann Comhairle. Taoiseach, first of all, I want to commiserate with all the families who have lost loved ones to this deadly disease. I want to thank the people of Ireland, everyone, each and everyone, for the massive sacrifice that they have made in the last 6 or 7 weeks and undertaken. I am calling on you, Taoiseach, to get as many people back to work as soon as is safely possible. Construction work and builders where they're maybe working at one-off houses. I want you to explore the possibility of getting those people back as soon as possible. Industries where social distancing is possible. Many companies and business people won't be able to return, sadly. I'm asking you, in relation to the farmers, to open up the markets and at least allow competition in the market. Allow the over 70s out of confinement, even with a mask, to go to the local shop. Because it's not fair on them when you see people are coming in here off of ferries and planes and going in their midst, very close to them, into holiday homes, and going out to local shops, and there's no one monitoring whether they're isolated or not when they come in off of these ferries. I'm asking you, as well as Deputy Michael Healy-Rae, to consider the over 66s who were employing people and who gave employment, and to bring their pension up to the 350. And then the seasonal workers, because Kerry depend so much on hotel workers, bus drivers and all that, and if the lockdown hadn't come for another week or two, all these people would have been back to work. And now they're running down their stamps, and some of them don't have any stamps left, and they're not entitled to job seekers because their partners or whatever have other income and they're left behind. I see where tonight, following Fianna Fáil and Fine Gael's budget, where 2 cents per litre is being added by way of carbon tax to the price of petrol and diesel, and the whole of the country closed down. That is the fact. You're doing your best to get the Greens on board, and what will the carbon tax charge be when you'll have them with you? They're talking about reducing the national herd, and we read today what the US are in serious trouble in providing beef, and we're supposed to reduce the national herd. I'm amazed that you're considering, both yourselves and Fianna Fáil, of blocking the Shannon LNG, and North Kerry is starved for jobs for years and years, and millions has been put into this project, and not to mind the importance of having our own access to this natural gas. Taoiseach, I'm asking you, why are you not calling for an investigation to how and when this virus actually began in China? Is it the case that you don't want to know? Because I can tell you that all those who have lost loved ones to this deadly disease would like to know and be told the truth, as they can touch and embrace or talk to their loved ones who are gone forever. This virus was in China long before January 20. Some of the PPE stuff that he paid for and went out of your way to thank them publicly for was given to them by the Italians in early December. I'm asking you now not to buy another bottle to contain this virus from the Chinese until we know what's the truth, because the people are entitled to the truth. And I'm calling on the United Nations to carry out an international investigation to what happened, because we need to know, and if they're culpable for anything, or whoever it is, they'll have a job in compensating the world they'll never compensate them for the people that have died, but they should be made to compensate for the money that the countries around the world have lost, including and none more so than Ireland. Thank you, John Court.
Now we move finally to the independent group. Deputy Pringle, Deputy Harkin, and I think you may be giving some time, are you, to Deputy McNamara? But there's some questions, statements and questions, is it?
Yeah, yes. I just have 2 questions, and if I could ask the Taoiseach, and then he respond to them, and then Deputy Harkin, and I think she's sharing time with Deputy McNamara as well. Good. So
the floor is yours, Deputy. There.
Thank you, Cancora. Taoiseach, just have two quick questions just to ask you in relation to the COVID-19 defence that's going on at the moment. And the first one has been topical for a number of days across the country, but is in relation to the travel and for the people travelling from Northern Ireland into the Republic, that we are told that the Gardaí can't instruct them or can't stop them and tell them to go home or tell them to do anything in relation to the, their movement. And I would just like to know how that happened. If that is the case, how it happened and what you intend to do about it. I don't think it's as prevalent as there's not hordes of people coming across the border or anything like that there, but it is something that's very frustrating for people who are trying to manage and live the restrictions that we have here in the south as well. And the other question I have just in relation to, for you, Taoiseach, is in relation to the Keelings workers, which has been a lot in the media and as well over the last couple of days. And I just noticed that recently we've discovered that the Keelings advised the workers that they could quarantine in numbers of 49 people at a time in a quarantine situation, and that they have advised the workers that they were advised of that by either NEFIT or the government or the department or whoever it was. And recently, when that was publicised, then they reduced that down to 19 people. So I'm just wondering who is actually advising Keelings in relation to this, and where is that advice coming from, and what is is the actual proper advice? Thank you.
Just in relation to the regulations, I asked the Attorney General, the Minister for Health, and the Minister for Justice to examine this a couple of days ago, and they've done so. Having looked at the different options, it's their view that the regulations don't need to be amended, but what is required is greater cooperation between PSNI and An Garda Síochána, because people coming from Northern Ireland into the Republic of Ireland are breaching Northern Ireland law. And essentially, and vice versa. So unless we prohibit people crossing the border, which we're just not going to do, what's required is cooperation, because somebody going beyond the 2 kilometres without a very good reason, like being a cross-border worker, for example, is breaching the law in one jurisdiction. And what's really required is cooperation between the police authorities. What we don't want to do is make it illegal for people from Northern Ireland to come into the Republic of Ireland for reasons I think you'll agree with. So enforcement is going to be the issue, and that's going to require cooperation between the PSNI and Garda Síochána, and I'm reassured about what the Garda Commissioner said about that in recent days. I'm afraid I can't answer for you definitively a very straight question that you ask as to who's advising Keelings. I think as far as that debacle is concerned, it was probably a case of there being many arms of government and all arms of government not having spoken to each other. I think that's what went wrong there. But we do now have a much better procedure in place. Anyone entering the airport has to fill in a form, declare where they're staying, give their mobile number, all of those things, to make sure that they self-isolate and self-restrict for 14 days. And we now have a mechanism by which Department of Justice staff can check with people to make sure that they are following those instructions.
Thank you, Taoiseach. Each day as we gather in the Dáil, the numbers who have died from COVID-19 increase, and I think it's really important that we remember those people and sympathise with their families, all of whom are grieving in isolation. It's also important that each time, I think, we recognise the huge efforts made by those in the healthcare sector. And while we have made real progress, both at individual and government level, in containing COVID-19, there are a number of unresolved issues in the healthcare system. First of all, Taoiseach, we hear that nurses have not yet been paid. There are agreed increases. Some hospitals paying, some not. That just needs to be sorted now. Another pressing issue is the fact that, at least from the people I speak to, that in some of our nursing homes, they're still not adequately staffed or have adequate levels of PPE if either their patients or their staff contract the coronavirus. I mean, I've heard the panic in the voices of some of the people in this sector, and while progress is being made, we were slow off the mark in the first place, and I think immediate and urgent efforts are needed. I really want to emphasise that point. Another issue that really hasn't been dealt with, it was mentioned here this morning, but just briefly, and that's the contract that's being offered to private consultants and private hospitals. Now, I fully support the actions taken regarding the takeover of private hospitals, and we can see it as a success that over 2,000 beds are not being used right now. However, I believe there is a need for flexibility in the contract being offered to the consultants in order to be able to treat their emergency non-COVID patients. They must be insured, and if they don't sign that contract by next Sunday, they don't have insurance. But if they do sign it, they leave all their other patients in limbo. Taoiseach, all patients matter. All patients, and that should be the bottom line. Whatever ideological struggles are going on, now is not the time. We need to focus on COVID and non-COVID patients. As you said yourself, Taoiseach, cancer has not gone away. We need a flexible solution, and we can fight our territorial battles later. It's patients that matter now. I also want to briefly mention the issue of domestic violence. We've had a top-class awareness campaign from the Department of Justice and some really good interagency response. For example, the Gardaí are proactively following up on COVID calls on domestic violence. And I think that's great reassurance for people. However, Taoiseach, some people still have to leave their homes. In my own constituency of Sligo Leitrim, there is no emergency refuge accommodation, so people have to access rental accommodation. We need a timely way of helping those people, and one way is to allow them to avail of short-term rent supplement. And I would ask you to please reconsider this as an emergency solution. A final comment, and it's been brought up already: refunds or vouchers from airlines. Customers, as you say yourself, are fully entitled to refunds. I think the government should stand on the right side of this issue, and that is with the customers. Yes, I heard what you said, that airlines may need support, and they probably will, but one of the ways that we could do that now is to look again at Fifth Freedom rights around cargo transport. It should be full refunds for customers. Thank you.
McNamara.
Taoiseach, tomorrow it's widely anticipated you'll announce some easing of restrictions. Tomorrow is May Day. It's the start of the Mayfly season on the Corrib and Lough Derg. It's something that people have done for generations through the Spanish influenza, which was far more deadly than this has proven to date. And before that, it's a solitary activity by its nature, by its definition. I'd ask you to bear that in mind in easing restrictions. The idea that on Garda Síochána's time would be taken up with stopping people going out in boats and spaced out across large lakes like Lough Derg and Lough Corrib is ridiculous, and I think it calls into question the necessity to make sure that our restrictions are necessary and proportionate, and I'd ask you to look at that issue and how mayfly fishing is treated. I'm not talking about people on jet skis and dangerous activities. I'm talking about something that's happened for generations.
Thank you very much, Deputy. That concludes the questions and statements I'd asked to Taoiseach. Now, if you'd like to make a concluding statement.
I'll certainly seek advice from NEFID on the mayfly fishing. And I know the issue of just solitary fishing in general, people fishing in a local lake or river on their own, has come up on a number of occasions. So it's something that I'll seek advice on. Deputy Harkin there mentioned the whole issue of domestic violence, and there is a real concern at the moment that the fact that people are at home so much more than they would normally be is a real risk, both in terms of an increase in domestic violence and also an increase in child abuse as well. And that's something we're very aware of, people being at home, and often anyway, I think everyone can understand why those are concerns, and it is something we're very attuned to, and the party and the government is attuned to that. In terms of domestic violence, there are 2 new women's refuges that have opened in recent months in Galway and in Dublin, but the North West is a very obvious and gaping gap when it comes to the provision of a domestic refuge for women. And I hope that's something we can sort out sooner rather than later. In the meantime, I know hotel accommodation can be used. I don't see why rent supplement couldn't be. So I'll get that checked out. I think that's a good suggestion. In terms of the pay agreement with the nursing unions, I've seen some reports in the media about that, but I will get that checked out this week. The pay increases that were agreed with the nursing unions are linked to a new contract, and also reforms and the adoption of more modern work practices in the interests of patients and taxpayers. So there is a linkage there. But I absolutely believe that public bodies should honour the agreement, as unions should too. In relation to capacity in the hospitals, our private hospitals are about 33% occupied, our public hospitals about 80% occupied, our ICUs about half occupied, and City West largely unoccupied. That is not necessarily a bad thing. The reason why that is the case is because we want to be prepared to make sure that our hospitals and ICUs were not overwhelmed the way they were in other countries. So it's a good thing that we have that spare capacity. We may need it yet. This could yet go wrong. And I wouldn't like us to make the mistake of relinquishing that capacity only to find out in a few months' time or over the winter that we really need it. It is possible, I think, over the next couple of weeks to use some of that capacity to bring back online some elective healthcare treatments and other interventions that should be happening, but we do need to be wise about it. We'd all love to see more orthopaedic operations starting again, but some of those operations can take up an ICU bed for 12 days. And things can change very quickly in 12 days when it comes to this virus. So we just need to be smart about that. It's not a bad thing that we have spare capacity in our health service. It's an unusual experience in Ireland, not necessarily a bad thing. And we should, I think, retain some spare capacity for as long as we can. Deputy Ryan, I think, spoke very eloquently on the issue of nursing homes, which have been very badly affected. And that is extremely sad and tragic. And we see across Europe between 40 and 60% of all deaths are occurring to people who had been residents in nursing homes. And if you think about it, a nursing home is really one big household with a lot of staff coming in and out. So it's very hard to keep the virus out. And once it gets in, it's very easy for it to spread. And I think if we were to cocoon people in nursing homes the way we have at home, you'd essentially, as Professor McConkie pointed out, you'd have to put effectively the nursing home into lockdown and have the staff stay overnight and not see their own families. And that would be extremely difficult to do, possibly impossible. So it does raise questions for the future as to what our nursing home model should be and what our elder care model should be. Certainly, I think we'll all agree that we need much more investment in home care so that fewer people have to go to nursing homes as early as they do. The last government was able to increase funding for home care by 40%. I doubt the next government will have that kind of money. So we'll have to come up, I think, with a new model for funding home care. To make sure that home care is an option for more people for longer. What we've been doing for a long time now is moving towards much more modern nursing homes, replacing nursing homes with 150 or 200 bed single room occupancy nursing homes. Maybe that wasn't the right answer. We've seen some outbreaks happen in some of the most modern nursing homes, somewhere like St Mary's in the Park, for example. Almost all now modern buildings, almost all single rooms or double rooms, under public control, linked with the Matter, consultants on site, all of those things. Maybe we need to consider a different model, something similar to what we've done in the disability sector with people in houses of 3 or 4 or 5, rather than big nursing homes of 150, even if they're all single rooms. Maybe I'm wrong, but that's the kind of thinking I think we're going to have to think about. And the other issue is the whole issue of clinical governance. It's always been the view up until now that everybody who's a resident of a nursing home is a resident, and they should all be allowed to have their own GP and their own GP of their choice. But the effect of that has been that in a nursing home of 120 or 130 residents, there could be 20 or 30 different GPs, but no one person who's actually in charge as a medical director. There's a person in charge, but they're not a medical person. So we've a lot to think about, I think, across Europe about the future of nursing care and nursing home care as a consequence of this.
And that concludes that part of today's business. Now, in accordance with the order of the House from earlier, we will take a 5-minute sus while we prepare for questions and discussion with the Minister for Enterprise and Business. Thank you.